Hello, I'm Jean-Louis Mandel, a human and medical geneticist from Strasbourg, France, and I want to tell you about our project Genida for genetic of intellectual disability and autism. Now, intellectual disability, with or without autism, with or without epilepsy, affects about 1.5% to 2% of children or young adults. So it is a rather frequent condition. But what research in genetics and the ability to sequence the genome has told us in the past few years is that actually about 60% or maybe more of people with this form of disorder, intellectual disability, there is for 60% of them a genetic cause, that is, a mutation affecting a gene or a segment of a chromosome. But the complexity is that there are actually 1,000 genes and also many segments from the genome that, when they are abnormal, can cause such a genetic form of intellectual disability. What it means that this is in fact 1,000 different rare diseases. Now, when you have a rare disease of genetic origin or not, but what you want to know, what is the specificity of this disease? What is the course of the disease? How will it evolve? Will it become more severe or stable, or may it improve? Will a child that has a delay in learning to speak, can we expect, depending on the condition he has, that actually he will learn to speak in an understandable way? Or will it become stable, or even in some, unfortunately, some case, will it go down? And it's also very important to know, for optimal health care of the child or adult, whether this particular disease, this particular genetic form of intellectual disability, can be often accompanied by other medical problems, like neurological problem, for instance, loss of sense of equilibrium, or neuropathy, or digestive problems, or cardiac problems. And this is important to know because in most cases you can take this into account to have at least a better medical care of the person. But the problem is, how do you collect this information for 1,000 different diseases? You know, medical geneticists who see patients are very busy persons. They don't have, in general, the time to fill a long questionnaire. And furthermore, they don't see the child so often. They see him for diagnosis, but then after he will be seen by his GP, doctor, by his educational environment, and of course by his parents. And so our idea was that those who are the best to actually tell us what is the course of this particular form of intellectual disability are the parents. They have the motivation to do so. They have the knowledge of what happens to their child. And so what we have done is a questionnaire where parents can first go to the website, register, tell what was the diagnosis for the child, what gene was found to be responsible for the condition of their child. Is it the gene SHANK3, or DIRC 1A, or MECP2, for instance. And then they can start to answer the questions, and the questions go over the whole range of cognitive ability, of behavior, but also that the child has neurological problems. Does he have epilepsy, and if yes, what form of epilepsy, and does he have digestive problem, cardiac problem, etc. And when we have, for one given gene, enough parents who have answered the questionnaire, we can start to make statistical analysis to really know for that particular cause what is the course, what we call the natural history of the condition. And also because we'll have answers for children or young adults of different ages, we can reconstruct the evolution of the condition, not by waiting 10 years to see what becomes the child, but by having answers for individuals having the same condition but of different age. So how can you participate, help us in this project that started 5 years ago? You come to the website, Genida website, that is in English and French. The questionnaire right now is in 5 different languages. You register and you can start answering. And you can answer at different times. For instance, it may be sometimes that at 4 years of age, the child does not have epilepsy, and then 1 year later, he starts to have seizures. So you can come back and add this novel information, and we'll keep all this. And when we have enough data, enough results, we can analyze them and make them available to concerned families, but also to the professionals, so that they can see, for some of the most important observation, how to adapt the medical care, the general health care of the patient.